Hi and hello everyone. So in this video I'll be discussing how to study pharmacology from the HAP. So before you begin your journey of studying pharmacology, let us understand this. So all the videos before I introduce this, we will start with understanding what is normal, then understanding what is abnormal, and then the treatment. So you should understand the physiology which is normal, pathology which is abnormal, and then you will understand what is the treatment. For example, if I talk about the temperature, you should be knowing what is the normal temperature. So when you know what is a normal temperature, then only you will understand the fever. And if you know the fever, you know the treatment, it is paracetamol. So this knowing the normal temperature is what we mean by physiology. You should be understanding physiology first. And you should know the disease process, that is pathology. And once you know the pathology, you should be knowing the treatment, and that part is covered in pharmacology. So in our lectures, we have covered the physiology part a bit, pathology part a bit, and then pharmacology more. So these three P's are the pillars to understand a bigger part, that is medicine. So medicine is understood by understanding the three P's. These are the three pillars to understand medicine. Now along with that, nowadays the pattern of exams are integrating the things. So physiology is integrated with pathology and then pharmacology, and that forms the medicine. When you start using the app, what I suggest you is watch the video section for 30 to 40 minutes, because more than 30 minutes the mind cannot concentrate much. So once you have studied that for 30 to 40 minutes, then pause it, then try to memorize the things. Try to memorize. Now another best way is, when you are memorizing, if you can write down, it's better. So try to write the notes. If that is not possible, the notes is also provided, you can see that, but the best one is to write the notes. Now when you write the notes, it is going to stay longer. When you write the notes, it is going to stay longer. And when you write the notes and memorize and write it, you will know where you are making a mistake, where you are leaving the concept. So that is very, very important. Now this is how you have to do this. Now I will give an example here. Now there is a wooden log. This is a wooden log. Now the wooden log has to be moved into a certain distance. So this is the place you have to reach the wooden log, and it's very heavy. So if it is very heavy, a person comes with the idea and cut it into the shape like this. So he tells that I will cut this into this shape. One more person comes with the idea, we will cut the wooden log in the shape of this. Now who can reach it earlier? Will the wooden log itself reaches it earlier? No. Will this square type or a rectangular type will reach earlier? No. If it is the circular, it can easily reach the destination faster. So our role in this is to make your journey easier, to make the job easier, and to make your learning journey smoother, and to make the destiny and to achieve your dream faster. So that is the purpose of our teaching, making your dream come true. So that's our purpose. So I told you how to use the app. And then once you have done the video section, you have to solve the MCQs. But while you solve the MCQs, remember, in every MCQs, there are 4 options. Now many a times you will get the right option. Let us assume the question right option is C. But you don't stop there. You have to analyze why option A is not correct, why option B is not correct, and why option D is not correct. And you have to analyze these options, then only the solving of MCQs is complete. Without that, your solving of MCQs are not going to be complete. Now once you have done the solving of MCQs, it's very, very important you keep on revising this. So revision is very, very vital for your preparation. Without revision, whatever you have done is not going to give a fruit. So revise them frequently. Revision is very, very important. I'll give an example of cricket. Now, when you want to start playing cricket, you don't know how to play the shots. So that is taught by the coach. So coach will teach you. So that is the job what I will do. I will teach you. But if I teach and leave you, will you be successful? No. You have to solve the MCQs. That means you have to do the net practice. So what is net practice? Solve the MCQs. Solve the MCQs, correct? But if you do only net practice means there is no fielder, you are only there, bowler is there. But you don't know what is a real field looks like, how you are going to play the shot in the real field. So for that you have to do grand test. So grand test is the one which will have simulated matches. So you have to do simulated match. So once you are ready with that, then only you are prepared to give the exams. So you are prepared to play the cricket, prepared to give exams. So any of this link misses, your preparation is inadequate. You listen to the classes, but you didn't solve the MCQs, your preparation is inadequate. You did just solve the MCQs, but you didn't revise it again, inadequate. You never give grand test, that means you don't see the mixture of questions in one set of paper, then your preparation is inadequate. So that's the reason all these three are going to make the preparation easier for you. So please follow this, watch the video, solve the MCQs, give GTs, revise. So this is my advice to you. Then once I told you this, most of the videos I have started with some clinical based questions. So we have started with some clinical based, and I've tried to integrate with other subject, right? And also we have started certain videos with MCQs. So that will make your preparation easier. Now many times student ask me this question, sir, there are so many drugs. What is the best way to memorize the drugs? So remember, you have to know the basic drug first, then only go for the newer drugs. Now, best way to memorize the drug is, if you have a textbook of pharmacology, there is something called index. If you go to the index, all the drugs will be with starting with A, starting with B. So you will know what drug is what. For example, if they have given a drug by the name acyclovir and a drug called abacavir, which you are going to study later, they both sound similar. But acyclovir is used for herpes, abacavir is used for HIV. So that differentiation you can get it. And one more clue is, every drug will have a suffix vir. So it is used for virus. I'll give you some more example. If the drug ends with LOL, these are called as beta blockers. If the drugs end with prils, they are called AC inhibitors. If they end with vastatin, they are HMG coreductase inhibitors. So if you know these clues, it's very easy to memorize the drug. But if the drugs are entirely new, if you are not able to memorize, what I suggest is you have to stick that drug name in your room and see that every day. Or what you can do is, you can put the drug name to your friend name, and whenever the phone call comes, that drug name will come. So these are the ways to remember. And one more important way is, suppose you are studying hypertension in medicine. In there also you will see the drugs. So try to integrate the drugs from there. Suppose in the OBG you are studying a preterm delivery, then you try to understand what are the drugs used in preterm delivery, so you can integrate with other subject. And that will also boost up your preparations. So without integration, it is highly impossible. So that is what we can do. Now the next important thing is books. Okay, so if you are preparing for entrance exam, don't worry, we have given the updated content. But if you want some more knowledge, there are Indian author books. The Indian author books is K.D. Tripathi and Sharma Textbook of Pharmacology. Foreign author books, what we have is Gadsden and a book called Goodman and Gilman. So these are the standard foreign author textbooks which you can refer. So these are for reference purpose. And we have taken the information about all these videos and all from these standard textbooks only. So don't worry, the content is up to date. So this is what you have to start your journey of pharmacology. I told you, when you start using the app, remember we start with the pathophysiology, then pharmacology, then some clinical based questions will start. And when you are watching the video, you can watch it for 30 to 40 minutes, then pause it, try to memorize it. If possible, write it down. And whatever forgotten, again add those points. Then solve MCQs more and more, and then revise. Once you have done the revision, then give grand test. Then your preparation is adequate. So that is how you have to use the app. Thank you all.